In this module, we will provide a very brief overview of the need to focus on paramedic safety and well-being. Once completed with this module, you should be able to discuss broad concepts of safety and wellness as they apply to the paramedic. EMS is a great profession, but it obviously comes with some significant risks not faced by those in a typical workplace. As reported by the National Institute for Occupational Safety and Health, more than 22,000 EMS providers visited emergency departments annually for work-related injuries for a 5-year period from 2010 through 2014. Lifting patients and equipment, treating patients with infectious illnesses, handling hazardous chemicals and body substances, along with providing emergency transport of patients in ground and air vehicles, routinely results in sprains, strains, significant exposures to blood and body fluids, and falls. As a matter of fact, a study published in the May 2013 issue of Pre-Hospital and Disaster Medicine found that the rate of injuries in EMS are almost 2.9 times greater than they are for general private industry occupations. Of the non-fatal injuries suffered by EMS workers, a study published in 2016 by the American Journal of Industrial Medicine found that 1 to 2% of those injuries were a result of patient-initiated violence against the EMS provider. This same study also recognized that healthcare workers in general are almost 10 times more likely to suffer injuries as a result of workplace-related violence than those who work within other industries. With these statistics in mind, it is no surprise that the Centers for Disease Control and Prevention estimated that approximately 2,600 EMS workers received hospital treatment in 2014 alone for injuries resulting from work-related violence. Unfortunately, many suspect these numbers are also underreported. Beyond intentional acts of violence, numerous EMS providers are also injured and killed every year due to ambulance crashes. According to NHTSA data, there are approximately 4,500 ambulance crashes per year within the United States, within just over a third resulting in injuries. These crashes are responsible for approximately 33 deaths a year. 25% of those fatalities are either the driver or a passenger within the ambulance. Beyond physical injuries, protective services professions in general are now beginning to recognize the prevalence of psychological injuries suffered within the firefighting, law enforcement, and EMS professions. A 2017 study out of the University of Phoenix found that 84% of first responders admit to experiencing a traumatic event on the job. 85% have experienced symptoms related to mental health issues. 69% have experienced a lack of sleep. 46% have experienced anxiety. 34% have been diagnosed with a mental health disorder. 27% have been diagnosed with depression, and 10% have been diagnosed with post-traumatic stress disorder. Additional studies, such as a 2013 study published in the World Journal of Emergency Medicine, have also recognized and validated this disturbing trend. While approximately 3.5% of the adult population in general suffers from PTSD, the paramedic group in the study had a PTSD prevalence rate of 20 to 22%. In addition to this emotional trauma, EMS providers routinely struggle with poor sleep quality and fatigue, as documented in another study published in the April 2010 volume of Pre-Hospital Emergency Care. 44.5% of those who participated in the research reported experiencing severe fatigue while at work, with that percentage increasing as the provider's years of experience increased. This fatigue is problematic as numerous agencies and bodies, such as the Institute of Medicine, have held that healthcare provider fatigue can be dangerous to patients, and a 1997 study by Dawson and Reed demonstrated that higher levels of fatigue reduce reaction time to that similar of being legally intoxicated for the purposes of operating a motor vehicle. This same fatigue study also found that almost 85% of the 119 EMS providers who participated in the study were considered to be overweight or obese given their body mass index. While that may sound unbelievable, a study published in 2009 by the Obesity Journal evaluated 370 candidates for firefighting and EMS jobs within Massachusetts to find that 33% of those candidates, with an average age of 26.3 years, were obese, and an additional 43.8% were overweight. This caused some significant concern for the study's authors, as obesity is a strong predictor of premature disability, and emergency responders are already at risk for cardiovascular problems given the stressors of their jobs. If we struggle to take care of ourselves as emergency responders, how can we hope to help others and serve as a role model for them? Unfortunately, with all this being said, exposure to these traumatic experiences, compounded by poor sleep quality and fatigue, has also resulted in another shocking and troublesome statistic. The combination of fatigue, poor sleep, mental health issues, and relationship problems were all related to higher risks of suicide in active U.S. military personnel in a study published in the March 2012 edition of the American Journal of Public Health. To tie this all together, a 2018 study published in Pre-Hospital Emergency Care determined that EMS providers are 2.4 times more likely to die as a result of suicide compared to non-EMS providers. The study authors attributed this higher rate of suicide to constant exposure to acute and chronic stress, as well as higher rates of depression and substance abuse. Needless to say, safety, health, and wellness are critical subjects for paramedics looking to enjoy long and productive careers within the EMS profession. With that information in mind, this particular presentation was produced to provide a very brief overview of the need for paramedics and EMS managers to focus on provider safety, health, and wellness. Subsequent modules will delve much deeper into different aspects of paramedic safety, health, and wellness. The specific topics we'll be covering include standard safety precautions, personal protective equipment, stress management, prevention of work-related injuries, lifting and moving patients, equipment, disease transmission, and other wellness principles that apply to EMS providers. While we will be exploring EMS provider safety, health, and wellness in greater depth within subsequent modules, as this information is provided as part of the larger paramedic curriculum, we will not be delving too deep into these topics. These modules are designed to expose the paramedic to general principles of EMS provider safety, health, and wellness. For a more comprehensive look into EMS safety, health, and wellness, and risk management, it is highly recommended that you pursue additional education on the topic. If you are not sure where to begin in pursuing such education, WCTC has a 100% online EMS leadership and management program that has a course that deals specifically with the topics of EMS safety and risk management. Designed around the National Fire Academy's FESHI model curriculum, this 8-week accelerated online course explores principles of EMS safety and risk management with an emphasis on safety from the perspective of an EMS field provider. WCTC also makes the online lectures for this course available for free on our YouTube EMS channel. You can find these resources, along with others, at youtube.com/WCTCEMS under the EMS Leadership and Management Safety and Risk Management playlist. Given this brief overview, you should now be able to discuss the concepts of safety and wellness as they apply to the paramedic. In upcoming modules, we will delve into this broad topic with greater detail. This presentation was prepared by Waukesha County Technical College in Pewaukee, Wisconsin, and is distributed with an Attribution Non-Commercial Share-alike 4.0 International Creative Commons license. Copyright 2018 Waukesha County Technical College. For information on WCTC's numerous fire and EMS educational offerings, please visit us online at wctc.edu.